Hi everyone! Happy World Family Doctor Day! Welcome to this edition of Family Medicine on Air. Thanks for joining us. We're glad you're here. I'm Kelsey, a fourth-year student at The Ohio State University in Columbus, Ohio, and I'm a Region 1 coordinator for our FMIG network. Before I introduce our featured speaker on today's Global Health and Family Medicine, let me remind you that you can use the Q&A feature of Google Hangouts to ask any questions during this event, and we'll get to those questions at the end. The American Academy of Family Physicians and the FMIG Interest Group Network bring you this live social media series to help students across the country get a chance to learn about hot topics in healthcare from leaders in family medicine. In addition to today's broadcast, there's episodes from the past, episodes of FM On Air that are archived on our website, and this will be there as well. We'll also have some additional resources and information. Now to get to our speaker, Dr. John Parks. He's joining us live from Malawi. Just a little bit about Dr. Parks. He went to medical school at Georgetown and finished his family medicine residency in 2013 at the University of North Carolina. He went out to start his career as a family physician to find out where family med existed and where it did not, and to really help develop it in places where it didn't already exist. He found that place in Malawi, and he now works as a faculty lecturer there in the new Department of Family Medicine at the University of Malawi College of Medicine. He began his work there in August of 2014, working with an NGO on pediatric HIV and AIDS work, and developed relationships with stakeholders in this new family medicine movement in Malawi. He now has the opportunity to work with both undergraduate and postgraduate medical education in Malawi. He'll talk a little bit about what medical students need to know about global health and about his journey in global health. And then at the end, we'll take some questions. All right, take it away, Dr. Parks.
Well, Kelsey, thank you. And thank you for having me. And first, I wanted to start off by saying happy World Family Doctor Day. May 19th is World Family Doctor Day. I am speaking to you, as Kelsey said, speaking to you from Blantyre, Malawi, where I live and work in the Department of Family Medicine at the College of Medicine in Malawi, the country's only medical school. A little bit of background about me. I grew up moving around a lot. I was a military brat. By the time I finished high school, I had lived in Japan, Korea, and Belgium. So this thing of living outside of my home country comes naturally to me. After debating and trying to decide whether I wanted to do, for a time I was thinking about becoming a diplomat and working with the State Department, but I eventually settled on medicine and went to Georgetown, as you said, and it was there that I had an experience that was quite impactful on me and how I see the world and how I see healthcare and family medicine. So between my third and fourth year of medical school, I took a year off. I took a leave of absence from medical school, and at the invitation of a colleague, one of my mentors, Dr. Tim Fader, went and lived in Kabul, Afghanistan for a year and worked alongside Dr. Fader in support of developing that country's first family medicine residency. Now, as a medical student, one of my roles were to support small research projects that the faculty wanted to do but didn't have time to do, as well as support an evidence-based medicine curriculum to include doing some small QI projects with the young Afghan family doctors in training. And it was through that experience that I really saw the value of a broadly trained doctor, a family doctor, working in maternal and child health, and adult inpatient and pediatrics, and leading and teaching other health workers. And I saw the value of that, and that really stayed with me. So then I came back, and when I was finishing medical school, I was actually still debating between med peds and family medicine, believe it or not. I was going to apply to both. And it was another mentor, Dr. Ranit Mishori, who's a family doctor at Georgetown, that really gave me some wise counsel at a time when I really needed it. And she encouraged me to reflect and say, what is it you really want to do with your life? What sort of medicine do you want to practice? What do you want to be able to have the opportunity to do? And it was through that I saw that developing health systems, working to teach, having a broad understanding of many parts of the medical world, that was family medicine. And so I chose to apply only to family medicine, and I believe I chose right. And so then I went to UNC Chapel Hill for my residency program. And it was at UNC. I will be forever grateful for their investment in me. I think it was there that I learned some of the, really sank into me some of the values of family medicine, these ideas of continuity, comprehensive care, coordination of care. You know, we were talking just before this started about family medicine looks very different in different parts of the world, but there are some of these core values like coordination of care that are very important no matter where you are, no matter what your system looks like. And I think that was one of the things I really absorbed and gained and learned in residency. And so, as you said, I did a health policy fellowship through the Robert Graham Center. And based on my experience in Afghanistan, I was really curious to know. I saw family medicine was really valuable, and I wanted to know which countries had family medicine residencies, which countries did not. And it was through that with the support of Andrew Bazemore, the director of the Graham Center, as well as Alex Ivanoff of the Center for Global Health Initiatives, and many others, we were able to put together this a resource, to aggregate this resource of the global landscape of family medicine that really paints a picture of what's happening in family medicine around the world. And I think we're going to be able to put there's a map, one of the versions, one of the resources is a map that was developed, the World Health Mapper, that can be found through the Robert Graham Center website. I think we're going to put a version up as a resource for people. So after the fellowship, my wife and I were interested in moving overseas and looked for opportunities to do that. And the first opportunity that came along was this job with the NGO working on pediatric HIV/AIDS. But as you can probably tell from my story, this idea of family medicine sort of always has been with me for a long time. And so there was a job opening for faculty at the College of Medicine in Malawi. And during my year working with the NGO, I developed relationships and friendships with people here working in family medicine. And about a year ago, July of 2015, joined the faculty here. My job is to help support the development of family medicine here. And as you said, we have two big activities we run. One is an undergraduate course, clerkship in family medicine. It is required. It is a required fourth-year course for all medical students, and we send our medical students out to rural district hospitals to understand and learn the values and the concepts of family medicine in practice in the Malawian context. And then a new development in January of 2015, we started a residency in family medicine. The first 3 residents in family medicine have now finished their first year. They are also based at a district hospital. We have a cohort of recruits that have interviewed, and we are excited for them to start later in the year. My role, my job, was thinking about how to describe this, and it's a bit challenging because I don't do one thing every day. I think the best way to describe it is I try and solve problems, and some days I do that better than others. But in a very practical sense, I give lectures to our medical students and to our residents. I help coordinate the delivery of the curriculum, things like implementing these programs, the undergraduate and postgraduate programs, who will supervise our residents on this rotation, where will they go to learn that. As part of delivering this curriculum, this program, we have a lot of partners that we work with. And here I'd just like to mention we have good partnerships with Global Health Service Partnerships. It's a program, an acronym GHSP, that helps support us, and Dr. Alana Krolikowski and Jesse Reynolds, who worked with us in 2014, 2015, as well as relationships with the University of Washington and Swedish Family Medicine Residency, and Dr. Elizabeth Hutchinson, who spent a year here with her family 2014 to 2015 as well, helping support and continue this development of family medicine here. I also travel to the district hospitals, though not as often as I would like, but to work alongside and do ward rounds with our residents and our medical students. Much of the work is in the facility, meaning at the bedside, in the adult wards, in the male ward, or the female ward. But we're also developing the idea of a continuity clinic, and that is a new concept that we are working on. I think I had just a few pearls or reflections for the students. One was, when I pursued this experience in Afghanistan, I got a lot of pushback for it, but it was also because of that that I understood or learned better what I liked and what I didn't like. And so if you have you're thinking about an experience or you're wondering if this is something, I would encourage you to pursue experiences, because even if you come out on the other side and say, this is not for me, that's still beneficial. You gain something from that. But those experiences have really put me on the path and the direction that I'm on. I think mentorship is also very important. The challenging thing is I wish I had a blueprint for that, and I don't. There's no specific script for that. I think I found people that I admired, that I looked up to, and I intentionally pursued relationship with them. I think lastly, just for medical students, that somebody never told me when I was in your chair was I think the importance of your relationships and your partnerships. So what I mean by that is I would not be able to do this if my wife was not also keen and interested and supportive of doing this type of work. So my wife works for a human rights NGO and telecommutes from her home office in Malawi to her office in DC. And this is something that we mutually want to do together. And so I think it's worthwhile to have conversations with people in your life. I'm certainly not advocating everybody's going to live overseas, but it's important that those people around you understand, if you're interested in this or passionate about it, that they understand that and are supportive of you and your interests, because I think that can really influence your ability to do this kind of work. Now, I understand you have some questions for me.
That's right. We've had some questions submitted through beforehand and through the event, and we have about 3 minutes here, 3 or 4 minutes to answer some questions. So you kind of already mentioned this in your pro, but how do students get involved in global health and really make the most out of these international experiences that they may get?
I think one of the things is in some ways, is to reframe that question a little bit and say, how can I serve or walk alongside the people that I'm going to have an international health experience with or global health experience with, whether it's 2 weeks or 4 weeks or 8 weeks. I would encourage you to talk to the people that you're going with, to ask some specific questions to them. What does the experience look like? How long have they had their relationships with those partners? To get involved with somebody that has a relationship with a site or a place, a long-term relationship. A couple of the organizations that have these values are Child and Family Health International and Shoulder to Shoulder. These are two that I'm aware of, but there are also many others, and then people like your medical school. But when you go, I think I would encourage you to see what you can give to them and see how you can support and serve the people and the places that you're going to.
That's great. Thank you. Another question is, how do you make sure that there are the good partnerships that are sustainable, that you're not just going in and doing things for a week and then leaving the country in a different state than it was before? And how do you really make sure that there are solid partnerships and sustainability in what you do in Malawi, especially?
That is a great question, and I have to be honest, we don't have all the answers to that yet. This is something we work on and think about daily. I think one of the things is to walk alongside people, to ask a lot of questions, and as I was sort of mentioning before, but wherever you're going, sort of try and figure out what the relationship has been like. Ideally, you can be part of a larger story. You can be part of a larger relationship that is supporting and developing a place over time. And I think one of the roles for U.S. people, Americans traveling abroad or working internationally in the health realm, is education. I think, as I said, there are a lot of health workers, nurses, midwives, clinical officers that deliver service in Malawi specifically, but one of our roles can be to figure out how we can help improve the quality of care. And so that may be a teaching or a training project on a specific area where you have knowledge or where you can add benefit at the same time where there's a need for that. Yeah.
Great. One last question.
Yeah.
How is being a family doctor making you well suited to do global health?
That's a great question. I think a big part of it is the breadth, the real broadness of scope. I learned something recently from a wise family doctor in South Africa. There's often this thing, this saying, this rhyme that's said around about jack of all trades, master of none. You ever heard that before?
I have.
I did not know this until very recently, but that's actually only part of that full rhyme or riddle. So the full thing from the long time ago goes, jack of all trades, master of none, is oftentimes preferable than master of one. And so that to me, and if you don't believe me, Google it, was this idea that if you have, because different places have different needs. One place may have a need to develop maternal and child health services. One place may have a need to improve the quality of their antiretroviral therapy services. One place may have a need to get more continuity, more follow-up with their hypertension clinic. These are all skills that family medicine has. I think you offer a lot as a family doctor to a variety of communities that you work with.
Great. Thank you for sharing. This has been a really great episode. This is kind of wrapping up our conclusion to this episode. Thank you for joining us live from Malawi and really sharing about this experience that you've had and your journey. It's been neat to hear how you've grown into this career and kind of decided on this path and really gotten to work and do a variety of different things, like you said already, teaching, supervising, seeing patients in a variety of different settings. It's been really neat to hear about and to learn from you. And if you'd like to learn about global health or any of the resources that Dr. Parks mentioned, head over to aafp.org/fmonair. You can also check out our past episodes of FM on Air there, and you're welcome to use this video for an event with an FMIG group or just as a discussion tool. Another great resource is the section of the AAFP website on global health. There's so many different resources there about different global health organizations, topics in global health, resources for physicians and students, and many other things. And as well as think about attending the Global Family Health Workshop in September in Atlanta, Georgia, which will also be on that website. And as Dr. Parks mentioned, we'll have a link to the World Health Mapper so you can see where family medicine is and where it is not, and maybe travel to one of those places where family medicine doesn't exist yet and work to develop it, like Dr. Parks. So thank you, Dr. Parks, for being our first physician to host an international FM on Air. And happy World Family Doctor Day, everyone. Thanks.
Happy World Family Doctor Day. Thank you for having me, Kelsey, and best of luck in your future.
Thank you.